Today's webinar is a proven path towards outcomes-based commissioning and accountable care for social care providers, demonstrating the impact of an outcome using iPlanet, the electronic support planning system. Your iPlanet host today is Lisajane Humphreys, iPlanet Client Director for Aspirico. Lisajane is an experienced social care professional and former team manager with a UK provider working in the learning disability and mental health sectors.
So today we're going to be looking, as Chris mentioned before, about the whole life and the whole life cycle of iPlanet, and really focusing around the quality of services and the risk management of services, as well as compliance. So traditional time and task-based approaches to managing the compliance, risk and service quality have been expanded to measure outcomes, impact and value as providers move into 2017. Leading providers across social care are looking to lower costs and drive quality by eliminating paper-based manual care and support planning processes. And in doing so, they're also implementing proven approaches to linking service funding to statutory and provider KPIs, using an outcome-based approach to person-centred delivery. By transforming service delivery, these providers are winning more business and managing austerity, whilst at the same time improving service quality by creating more efficient, lower risk, integrated approaches to service management. And uniquely, as demonstrated on this slide, the new iPlanet version 5 allows providers to connect funding, service delivery and outcomes via a comprehensive person-centred care and support management platform. iPlanet enables the providers to roll out a person-centred, relationship-based approach to managing care by delivering live dashboard views of key operational metrics found and focused on continuous quality improvement, risk management and service impact, which you might hear today as outcomes, compliance and also business development. So we're going to take a rapid tour of the service user lifecycle management from web-enabled referrals, assessments, care and support plans, incidents, calendars, staff schedules, individual budgets, service user inclusion, risk and compliance management, and showcase comprehensive management reporting for all stakeholders inside and outside of the organisation. One of the questions that came up from some of the webinar registrants today was around integration options, and although we won't be covering this off today on the webinar in any great detail, I thought it would be useful to address this briefly before we begin. So there are some of our customers who may wish to connect iPlanet to some of their existing back office systems, whether that be the learning and management systems, the payroll, the rostering system and so on. The iPlanet Application Programming Interface, what we call the API, iPlanet Connect, can provide a range of data interchange capabilities based on open industry standards and formats. So it supports the both synchronous and asynchronous integration options. Typically, the data exchange can relate to staff, service users, progress, KPI, performance management, data, and so on. So if you would like more detailed information around this area, please do let us know at the end of the webinar, and then one of my colleagues will be happy to set up a call to discuss your business requirements in full. So let's have a little look at iPlanet version 5 before we get into the demo. For those of you who know iPlanet, you will know that we've built on our core iPlanet and we have a range of additional modules to suit each customer. So these range of functionalities that each customer chooses to configure to meet their own business needs, it means that each system is uniquely designed during what we call the quick start process, and it allows our customers to build at a pace and at a speed that suits them. And iPlanet has developed all of the core iPlanet functionalities and optional modules around the principles of AVITA, which is evidence, value, inclusion, transparency and accountability. More importantly, each area of core iPlanet and the optional modules have been designed to factor in what the person supported needs and wants, as well as compliance, risk and service quality. It's really important to understand that iPlanet captures that balance. This could be used as evidence to inspectors and commissioners, or it could even be to use as tender evidence and such as added value, as well as to make sure that safe and person-centred services are being provided. So the core iPlanet, very briefly, we're going to take a look at some of this shortly in the demo, but just to give you an overview of where iPlanet currently sits. So core iPlanet, before you add any modules on, captures things like the daily notes and logs, other professionals' notes and logs, all of the online web-based plans, gives you a document management and streamlined workflow, outcomes and KPIs, outcomes and actions, provider outcomes, as well as what we call person-centered outcomes. So throughout today, you'll be familiar with the word outcomes. iPlanet is talking about outcomes for the person, but we also do have the compliance side and the evidencing side around provider outcomes. There's alert panels and escalation notices, there's a messaging functionality, there's what we call the dashboard, which I'm going to show you shortly. We also have the electronic filing cabinet, all of the key performance indicators that you may be required to report against, and then we have an array of reports. Again, I'm going to show you a little bit more on those later. And then if we just look at the life cycle of the modules, we start with referrals. So the referral function is an optional module, and that allows providers to monitor referral activity and to minimize data duplication and errors, and I'll show you a little bit more of that shortly. Then you have the integrated needs assessment and risk management module, and a staff capture individual service user needs through an online assessment module. iPlanet then automatically starts to build a tailored risk and support plan template based on stated provider guidelines and individual needs. Surveys module. The survey module is provided for the user in the form of an accessible online questionnaire with the usual iPlanet accessible features to support enlarged text and icons, multimedia, different colour backgrounds. And they're configured for each provider, usually based on existing paper-based surveys. And that could be something like the reach assessment, or this could be a customer satisfaction survey, or even a measure of the journey type of tool. Then you have the calendar. The calendar module can be used by providers in a variety of ways, which I will tell you a little bit more about in the demo. And also for service users to support a wide range of activities and task tracking associated with the person's life and their support. The calendar also links into our services and funding module. So for example, if you're providing day services or you're using the calendar to capture residential services or supported living services, then you can deliver that support from the calendar, which will link into the funding module, and basically that captures the budget. It tells you what the person has, and then it tells you what you've spent. You also then have the day planner and the support task. So the support task, the staff tracker, this module includes the ability for supporters to populate the service user's support needs with selected daily, weekly and monthly care schedule items and tasks to be carried out for a particular service user or for a group of service users or for a location. So for example, it really helps and you really benefit from, especially the teams on the ground, splitting up the important twos and the important fours. So all the things that the person really wants to do, hopes, dreams, ambitions, learning new skills, and then all the things that you really have to do in order to support the person for that to happen. And that can be things like doing the laundry, filling out a housing benefit form every year, a one-off risk assessment, it could be medication 4 times a day, whatever it is. It's a support task and it has to happen, and it's not to be confused with the person's own individual outcomes. Then you have the new day planner module. So this is for providers who wish to further extend their iPlanet implementation to manage service team delivery activities all in one place. So the Day Planner optional module offers a range of additional calendar and schedule-based capabilities, and it also offers and includes the enhanced calendar team view. And that brings together all of the calendars for people supported for team members in one place. And this then includes the calendar entries for each individual, as well as the automated reminders and escalations, whether it's overdue or unfulfilled items, such as outcomes and actions and plan review dates. From the Day Planner module, you can then also, if you wish, actually schedule and view conflicts of how a support worker is going to be assigned to a calendar item, for example, or a support task, for example. So you can just make sure that you've got the right person in the right place at the right time without any conflicts. And then you have the funding, the budget management module. And the funding module tracks funding streams and budgets and service delivered to the individual person, the service user. And then these costs are linked into the service delivery activities, just like I mentioned in the calendar and also in the support task module. It offers a wide range of reports that can be tailored for management and funders, and this could be a block contract, shared support, shared sleep-ins, complex support levels, direct payments, individualised budgets, and so on. Then we have the staff qualifications module, which is very, very straightforward. This module allows provider management to track and report on staff competencies, training and qualifications, which I can show you a little bit more of on the dashboard later. And then last but not least, we have the event and incident tracking module. So this optional module, which is one of our most popular modules, provides an event management solution to provide the gathering and monitoring of events for people supported, staff and others involved. And this can be in areas such as safeguarding, complaints, compliments, missed medication errors, near misses, accidents to incidents, plus a robust solution for a range of risk management, compliance and early intervention needs. And that's going to assist you to analyse and correct hazards to prevent a future reoccurrence. Now you all know what it's like to run an incident and an event tracking system on paper. And again, there are lots of other incident tracking systems out there. The difference and the beauty here is iPlanet revolve everything around the person and can link back, whether that's to a risk assessment. We can also provide escalations to make sure, depending on the type of event and depending on the type of incident, the right person is notified and they have to do the right thing at the right time. A lot of this information, a lot of this reporting is indeed time-based. For example, if some sort of safeguarding issue came in, then it could be that this then triggers some sort of regulation notification to the inspectors. So whether that's the CQC or the CSSIW or the Scottish or the Irish authorities or our international authorities and so on. The full life cycle management for providers that we've mentioned today using iPlanet offers many more benefits as well along each step of the way. So it's really important to mention that iPlanet offers a unique return on investment to each customer, benefiting from the various modules, so whether that be just the core iPlanet and then you add on slowly but surely, or core iPlanet in an enterprise suite with all the modules, the return on investment is absolutely immense. Now, from the benefits of the referrals module to the person's profile, allowing you to collect all the information you need to keep about a person, which in turn enables you to report on analytics and the things like CQC type PMR stats as well, for use of a more, and even for most of a strategic business planning approach. There's an awful lot of information that you get and an awful lot of benefits that you get from every area of iPlanet, and that can be either the on-the-ground type of benefit, the inclusive type of benefit, and the kind of back-end reporting type of benefit. During the lifestyle and the life cycle for an active person on iPlanet, the compliance, risk and service quality elements are there to be benefited from also. So whether that's the web-based needs and risk assessments, the online support planning, the trackable outcomes and actions, online daily support notes, alerts, escalations for individual team members, and whether that be linked to an outcome, action or an incident, the ability to track tasks that are linked to funding and budgets at the same time as making sure that the person's at the centre of their support and can access their own plans and their own outcomes on iPlanet in an accessible way, as well as being able to invite and involve their family and their friends and their circles of support. So the reporting and the distance management functionality can help managers to identify areas of success as well as areas of poor performance, and iPlanet offers you the ability to deliver that instant snapshot to regulators around compliance, risk management and quality adherence across the organisation.